More nice. Thanks for the reminder. Tasha Latson. Yeah, so I'm a licensed optician. I'm behind Tosh the Visionary, and this is how I got connected to Hunter College Pre-Health Advising Committee. As a licensed optician, I've been through it all. I've been to TCNJ, a biology degree, and then I went on to do genetics research. I fell into optometry and loved it. I did have the option to study to be optometrist, but I decided to go the business route. So I'm with the students with the pre-health. There's so many options out there, and there's different ways to provide vision to our communities. I would love for Dr. Johnson to introduce herself and her background.
Hi everyone, I'm Dr. Sophia Johnson. I am originally from New Jersey and also attended the College of New Jersey. That's how Latasha and I know each other. And we studied together there. After the College of New Jersey, I had a few gap years actually. I had to think about 4 gap years before I went into optometry school. Um, and then I just graduated last year in 2023. And now I'm working for an OD-MD practice in Maryland. So I'm happy to be with you guys and to share some of my story. And just to let you guys know that there are different pathways to get to wherever you want to get to, whether that's optometry school, even medical school to be an optician, right? I'm very supportive of that. But really, my biggest thing and the takeaway that I want you guys to have is really go after what you want because at the end of the day, you can get it. And we'll talk about that a little bit more.
Yes. So I love that. I didn't realize you were in Maryland. I go through there a lot, so I'll have to come visit you.
Yes, please.
All right, so this is yes. So I'm really into African proverbs. Something special about them is they kind of always hit a nerve for me. Like it's not the generic leadership is attitude. It really gets down to the nitty gritty. So this one, true knowledge is not an accumulation of knowledge. It is an awakening of consciousness. So basically, you can read and have your reins on and try to get the highest GPA, but that's not going to be the thing that takes you to optometry school. That's not going to be the thing to get you into graduate school. You need to create a full package, right? And so we have the image of the lion, right? And it just is going to take a lot of passion and in opening your eyes to all the resources that are out there. You don't want to get to the end of college and say, you know what, I wish I knew that. I wish I knew this. So I really applaud the students that have joined today because I just want to open your eyes, even if it's just a little bit. All right. And so, to build that strong package, right, I put together just a blueprint, right? And I'm sure everyone is familiar with this. This is what it takes to get to, anything, right? We have strategy, right? How are you going to, be the eye care professional that you want to be? That includes grades, application process, and extracurriculars. So we're talking about that well-roundedness, objectives, right? Yes, you want to help people, but what else? I know Dr. Johnson and I, we both have our personal initiatives, and then we kind of intersected. Like, you know what? Let's get into the education piece, the diversity piece, the student piece. So that's going to be the thing to drive your application. What is that? What else? Diversity initiatives, I gave an example of that. Do you want to be the business mogul, right? Do you want to start 5 practices in one state? Mission trips, a lot of people do that, or become an educator. So figure out what your objective is and stick to it. Evaluation. Are things going to plan? So you need to be very self-aware. You need to evaluate. I've had classmates where, you know what, maybe the science classes were too tough and they still ended up very successful, traveling the world, doing the things that they love. But it's very important to be able to take feedback and evaluate yourself. You need to know, do you have the study skills necessary? Do you know where to learn those study skills? You need to know network and partnerships. What does your study group look like? If everyone is failing, right, how can anyone pass? You need to open it up, right? Just how we strive for diversity, you need to reach out to different students, see what they know. And then mentorship is super important. Lastly, we have performance. So overall, right, when you get towards the end, what does my GPA look like? What does the resume look like? And most of all, what is my reputation? If your name were to be brought up in a room, are people like, who was that? Or, oh yeah, I know Tosh the Visionary. She does this and that, right? You kind of want your name to speak for itself. And then Dr. Johnson, if you have anything yet?
Yeah, no, that's really good. All of those points were spot on, and I agree with all of them. Just to add to that last point, the performance piece,
Mhm.
um, I think that, and I'll talk a little bit about this a little later, when I was first trying to go to optometry school, because I had a few attempts, which is one of the reasons why I had a few gap years. But, you cannot think that you're going to get into optometry school with a 2.5, right? Because there are lots of students who are going and they have a 3.0, but they have a 3.5, 3.7, right? So you have to make yourself really competitive and build a strong application with those numbers in addition to your extracurriculars. And just to make a point here, I graduated with about a 3.0, 3.1 from the College of New Jersey. And to be honest, it wasn't good enough. And I don't mean to say that so that, makes anyone sad, but that just meant that I needed to put in the extra work. So if you are there right now, you need to put in the extra work while you can to build up your GPA. So what I ended up doing was going to a post-bac program in Massachusetts. I went to Elms College, and in that program, I soared, and it prepared me really, really well. So if you have to take extra classes or retake some biology classes, retake science classes, so that you can build your GPA, you should do that.
Yeah, I love that. And then Dr. Johnson, I would love you if you could speak about the programs that you saw at Hunter College and what prepared you to get
Yes.
to optometry school and through it.
Yes. So, I was researching and I saw that you guys had a pre-health program where you go through a bunch of seminars, or you have the option to go through those seminars, get to know a committee, and they get to know you, so that at the end of the program or your time at Hunter College, they can write you a committee letter, right? Very important, right? So, I think that's really awesome that you guys have these resources, because all of them, like how to build an application, how to write a letter, not recommendation, but a statement piece, how to get a letter of recommendation, all of those seminars that you guys have, please, please, please make sure that you're taking advantage of those opportunities in those classes. Um, and getting to know the people who are eventually write your letter. If you went to, I don't know, a conference or something that had to do with optometry, shoot them an email with a picture of you going to that conference, right? Or, maybe you did a really great job on a paper or a scientific paper or something like that. Shoot them that email to that committee and say, like, I'm so proud of myself. I did X, Y, and Z. And all of these things are really going to help you build a strong application, because they're going to have something to write to, right? They're going to have something to write about, and not just something, they're going to have something good to write about. And that's what you want. You want a good, strong letter from them. So that's my bit of advice there. You don't want anyone that's just going to write a generic letter about, you being in college and a science major and things like that. You want them to speak to specific things, so that, it'll make your chances a lot better of getting into school. Really important.
Very good.
Um, the next thing I wanted to talk about, did you have something to add,
No, I'm
Tasha?
just saying, no, I definitely agree. The next thing was like financial aid, right?
Yeah, so um, financial aid, in terms of your debt estimate, I would say you have to factor in undergraduate, right? Like if you have student loans from undergraduate school, then you also have student loans from optometry school or any other program. Like for me, I have student loans from that post-bac program that I did. And so you have to factor all of that in. And it's going to vary from person to person. But in my research, I saw that, you're going to come out with about, of course, if you don't have anybody paying for your schooling, right? You're going to come out having about $200,000 worth of student loans to pay back. And that might seem like a hefty number, and it is. But the idea is that you're either, within a few years, within 5, 10 years of graduating optometry school, you should be making that, if not more. So that's going to help you pay it back. The other things is that, you're going to be able to get scholarships. There's the American Academy of Optometry, there's the American Optometric Association, and there's the National Optometric Association, as well as another organization called the Black Eye Care Perspective. All of these organizations have scholarships that are available to students before they get into optometry school. So please write down these organizations and look up these organizations because you can actually be a part of the Black Eye Care Perspective right now, even if you're not of African American descent. You can still be a part of these programs. And they actually have a program that is at New England College of Optometry, NECO, which is not far from you guys. I think, you have students that either go to NECO or SUNY, right? Because they're so close together. And NECO has some sort of collaboration with Warby Parker. And Warby Parker is giving out full scholarships to students. So please, please, please look into that. Another thing is you can apply to different scholarships at your specific school that you're applying to, whether that's SUNY, NECO, or Pennsylvania College of Optometry, right? Grants as well. I did get grants. I did do work study. And of course, you make sure that you fill out that FAFSA every single year. And just like you do in undergraduate school, you do it in graduate school as well.
I love that. Thank you. And then for the next one, it would be study skills. Before I talked about that self-awareness, and I really want to share a personal story. So we're all coming from high school. We're all coming from different levels. And then you take your first college test. And that's really leveling out the playing field. I'm not sure if everyone just hit the ground running, but there was a time. First bio class, took my test. I was like, oh, I always get A's. If I could just memorize it. No, these take critical thinking skills. I think my first bio test, I had like, I don't know, maybe like a 60. And I was like, what is this? If you come from being a straight A student, never seeing like below a 80, 88, it can really do something to your self-esteem. I want you guys to know that you're not your grades and there's always room for improvement and there's always that resilience after failure that's really going to prove if this is the path for you. My next score, I talked with like an older student. I guess she was a sophomore at the time, and she goes, write the score that you want on your next bio test. Go to your professor, figure out how to study, and that's what I did. She goes, yes, you saw the chart, but do you know what it means? Like, do you know how to analyze the graphs? If I were to ask you about that. So that is the level of thinking it's going to take to get through the standardized tests. Yes, you can memorize everything you want, but you need to be able to think, right? Because this is what you're going to have to do with your patients. And then also I mentioned before is to analyze your study groups. Don't just have one. Everyone has different ways of thinking. Some people know people in the grades above. They know who took the test. You really want to tap into your resources. And then I'll open it up. And just to redeem myself, I did get that 90 that I wrote down on the bio test. So it is possible after failure, right? And that's something you never forget. And if Dr. Johnson has anything that she wants to share about study skills, she can.
Yeah, I would echo that. One of my first, so when you first get into optometry school, they try to level the playing field. Everybody takes a bio class, they take like some other chemistry classes or something like that. But it's kind of like this really big bio class that, but they try to just, level out, make sure everybody has the same understanding when it comes to that molecular biology, right? And I took my first test in optometry school, and we all did very, very bad. But, coming out of, all the programs I was like, I was doing great, and I think the average for that test was like a 60 in optometry school. And I was like, that's it. I don't belong here. I shouldn't do this anymore. Anything, everything like that. All of those thoughts went through my head. I'm like, what am I doing here? But at the end of the day, you bounce back. Like Tasha said, like, you go to your professors, you talk to them, you analyze your study groups. All those things helped me after that. And it wasn't about, oh, I can't do this. It was more so, this is graduate school now. This is no longer undergrad. Like, this is a new level. So it's expected. Like, every single time you reach a new level, when you go from high school to college, you're now in college, it's going to look different. When you go from undergrad to optometry school, it's going to look different. So and then you adjust. And that's what she's talking about, the ability to adjust, the ability to, take what you have and say, you know what, I'm going after still what I want. I just have to make some changes.
Perfect. Thank you so much. And then next, I do want to talk about extracurriculars. The things that I did in college still affect when I deal with patients and customers today in optometry offices. So, for example, I did fencing. I did fencing in middle school. They had a fencing club at TC&J. Lo and behold, now patients come in and they could be of a totally different demographic, right? So, right, I'm African American. They can be Asian, and it's like, you know what? I was like, oh, you have a fencing shirt on. I loved fencing. And then I had to prove it. Like, oh, I use this sword. And then it's just when you connect with the people that come into your office, even as doctors to patients, there's a different type of care that you can give them. This lends to having a well-rounded application. You guys aren't robots, right? They don't want to know that you just stayed in the library the whole time. Can you connect with people? What sports are you going to do, right? The different type of clubs, hobbies, community service. These are those human experiences that are going to help make you a better doctor, and that's going to be the end goal. So, Dr. Johnson, if you want to share like something extraordinary you did or anything that applied.
Yeah. So I guess, for me, not necessarily what I did, but I'll talk about something that happened in optometry school. So, we have this really big baseball game every year, and it's students against faculty, right? And so, that's if you play baseball, then that's something that you can bring to the team, right? Or maybe you like to do design. Now you're designing the baseball shirts so that you could do you never think about how, but yes, you do things like this in optometry school. You do fun things. You do connect with your faculty outside of the classroom, um, your professors and people that see you outside of the classroom. And if you go to SUNY, most of them actually are the ones writing your textbooks, which was a really cool thing. But, they're going to expect you to know things at the highest level. But then you also get to, do some healthy competition with them in baseball. So, if you have that skill. So I think that, that's definitely a good thing is, bring some outside things. And the only other thing I like to add, I don't mean to be long-winded, is that if you are in a science major, and I always like to say this, if you are in a science major and you want to go to any type of health profession and you are like, I actually love art or I love ballet, and you always wanted to major in ballet or art or something, I say major in those things and take your prerequisites still. Because imagine the look on admissions officer's face when you're like, yeah, my major was ballet, but I always wanted to be an optometrist. Now you're bringing in, you know, this dance and this creative expertise to the field, and, it might seem small, but, go after something that you actually want to do. That's what I wish somebody would have told me. I really did not like biology. Okay. I thought I had to be a biology major because I wanted to be an optometrist. So I mean to tell all of you guys, if you love something else, it's not too late to switch your majors. If you love something else, go for it and then just make sure you take your prerequisites for optometry school and you're going to be golden. They're going to love you for it.
Got it. And Dr. Johnson hinted on the with the baseball game, right? You want to put yourself in spaces where you can market yourself. I know
Hmm.
as an optician, this is really important, right? You want to differentiate yourself. You want your business to stand out there. You want patients to know that you serve. You want them to know the languages that you speak there and the demographics that they're welcome there. So if Dr. Johnson can go into how better to meet the representatives and admissions teams.
Yeah. So I think the best thing that you could do, and something that I eventually did do that really helped me, was meet the admissions officers. Okay. I asked them, why didn't I get in? Not like that, but I asked them, is there any way I can make my application better, or what am my application in particular didn't make me a good candidate, or didn't make me look like a good candidate to the people that were looking at my application. Are there any programs that I can be a part of? And they were like, yeah, we have this program, but you're not native of New York, but you can audit this program. right? So even though there are certain criteria that you might have to meet, you can still be a part of these programs. You can still be a part of these things. And you may not get credit for it like somebody else, but you've gained the knowledge and you've showed the admissions team that you want to be there. That's where, on this side where it says C-step. Go to tours of the school, see if you can ask for an interview, and not necessarily an interview as in, you're starting the process of the admissions process for optometry school, but try to get to know, some of the admissions officers, ask them questions and have like your own pre-interview, right? Allow those people who are going to be admitting you, get to know you. Okay, that's one of the best things. Send them an email. They love to talk to students. They love to invite you on campus and be a part of different programs. I was a part of the National Optometric Association as a student and now as a provider. And we host a convention in a different city every year. This past year it was in Philadelphia, and we had 10 undergraduate students attend this conference. Do you know how big that was? They met doctors, they met industry leaders, they met optical leaders, they met all these people, they met other optometry students. Now they have all these resources to not only build their application, but they have people who can write their letters. They have people who were alumni of the schools that they want to get into, right? So, see if there are any conventions coming to New York. Where you can go and meet certain people, meet these providers, meet these doctors, meet these professors, right? And now you have an advocate, and that's the best way to market yourself. It's not just, doing your research, right? It's actually getting out there and attending some of these things and meeting some of these people. So I'm excited for you guys because that's a good one.
I love that. And so, going into, right, marketing yourself, a lot of times students, high school students, and then even college students come in and they go, I can't find an optometrist to shadow. Think about the load of an optometrist, whether they're new, seasoned, right? To take on students, to have them shadow, it puts a load on their work because they also have to make sure that the patients are comfortable with students watching you, right? So this is where you need to develop those relationships. And how do you get your foot in the door? You can work in the office, right?
Mhm.
And they're asking me as an optician, right, where can I find optometrists? They're out there and they're willing, especially like bigger corporations. She mentioned Warby Parker, right? The bigger ones, lens crafters, right? We need optometric techs and people to sell the glasses. I've had an optometry student who I wrote her recommendation letter for. She worked as a sales. Through that, she was able to see the different type of prescriptions, the different cases, how it gets treated on the other side of it, right? And then overall, she's just a great student. So, she didn't ask for a handout. She didn't ask like, hey, can I just sit in your office? It was more, what can I do for you? And then maybe I can get something out of it. It's called a warm ask, right? So please avoid just going up to optometrists and saying, hey, can I shadow you? It's different, right? If you say, okay, what can I be of service to you? There's paid and there's unpaid, right? Some are really great. So if you can get to work as an optometric tech, you'll be able to see different images and then pull the doctor to the side. Hey, I see the little dots. What is that? You'll learn things like drusen, right? So over time, you'll see patient after patient after patient. You'll be able, you'll be able to recognize certain things, but you don't have the ability to diagnose, but it'll be easier for you when you're in optometry school. Identifying mentors. I know I'm kind of jumping around, but identifying
Good
mentors.
one.
Yeah, I'm gonna just free talk. I wanted it to be more relaxed, right? One thing that you won't find on Google or ChatGPT is not all mentors are good mentors, right? So you have to decide, is this mentor where I was? Does this mentor know what I need to get to the next step? right? I'll share a very special story that's near and dear to my heart. When I was doing research for a principal investigator, right, I just had the hardest time. Like the work was good, everything was perfect, and then at the end of my contract, I go, I wish we could have got along better. And she goes, I got into an accident with a Caribbean lady, and just from there, and I do apologize for how I treated you, and I shouldn't have. If we had had that conversation in the beginning, right, the trajectory of things would have been different. So you never know. And people are human, right? I got this amazing experience. I got to research Lyme disease and syphilis, but it could have been better. So just know that you're dealing with people too. Make sure they have the time for you. Make sure they're accessible. I have doctors in my phone like, hey, I'm thinking about doing speaking engagement. What's my first step? Oh, this and this. Don't ramble. Like certain things like that. So, you want people that are looking for your best interests, right? So use your discernment. And if Dr. Johnson has anything to share.
I actually don't. That was great.
Okay, very good. So then letters of recommendation, right? I mentioned that I did write one, and then I was able to speak to her character. Yes, you want to attest to the academic capability, that's your GPA, problem solving skills, but that character. So for the student that worked in my office for America's Best, right? If a patient came in irate, upset, no, it's not her job, it's my job, right? They have to come and get me out of the office as the manager. But she was able to de-escalate things. And you can imagine that type of skill is needed to be for a doctor. So you want the person that's writing your letter of recommendation to actually see you in action, right? If you get a copy paste, I've been on the other side of it where I've seen recommendation letters like, does this person even know that person? Right? You don't ever want to be on that side of it because it really shows, right? So, right, you do want them to speak to your character when times get tough or even the best of times. And don't be scared to share personal moments too, because this is what's going to make your application really stand out. So we have there. All right. So when I was interested in optometry school, I decided to not because of like the loans and the financial. I was just like, oh, I just want to be free. Right. But I really give kudos and what I used was exam crackers. This was really just down to point. They kind of spoke my language. Like I just wanted cut, dry practice questions. I used Princeton Review for the MCATs. Really fun. A lot of people who take the MCATs take the OATs at the same time. So as a pre-health student, you might want to consider that, right? So you do well in this test, you do that here. Some people take the test for dental at the same time, even if you're keeping your options open. So say you just throw everything at the board if something lands, right? But make sure you take them all at the same time. And then yeah, so Dr. Johnson, right? I know you went through this process of actually getting through the OET obstacle. Anything to speak to for here?
Yeah, I guess one of the things I wanted to mention was to have a study schedule, right? Um, I actually ended up taking the OAT 3 times. So that's 3 times the amount of money. And so, one of the reasons why we're both here today is so that you only have to take it once, right? And so the first time, I tried to take it right out of college. I was like, I'm ready. I studied all this stuff and 4 years in school. Let me just take the test, not realizing that, I needed test taking strategy. I needed to know when to skip a question and when to dwell on a question. And I didn't have that knowledge the first go around. The second go around, I was like, okay, I need this knowledge, but I really wasn't disciplined with my study schedule. I had my study schedule, but I didn't stick to it. I was like, oh, I'm gonna go with a friend here, or I'm gonna have to do this, or I have to do that. And it was just a lack of discipline. That third time was the charm for me because not only did I have the discipline, but I had all the materials I needed. I used Kaplan. I had the support, the encouragement from friends and family, and really like I had something to prove to myself. And not only did I stick to that schedule, but I studied every day, right? It was even if it was 5 minutes, I studied. Um, and that turned out wonderful. Knocked it out the park. And so, I think for you all, just making sure that you don't miss out on opportunity to do test taking strategy, right? And then also making sure that your study schedule is good, it's complete, and you're disciplined with it. So that's how I think you're definitely going to do well if you conquer the oats if you go ahead and do all of those things.
I love that. And one of the major points on the slide I want to point out is, are you good enough to teach it? Like, you don't want to just learn the material to check off A, B, C, or D. If an optometry student or someone studying for it comes in front of me or works in my office, I go, let me take a look at what you're studying, right? I'm like, oh, valence, I know that. SPF, right? So you got to be able to like have it ingrained. It should be kind of like swimming. Like, okay, I studied this once, but when it comes up in real life, right, you'll be prepared. And sometimes I'm like, dang, will I ever have to know organic chemistry, reagent, molecular reactions? When a student comes, like to me, it's fun. So, you don't ever want things to leave. And then maybe on the side, you can get, a tutoring job, right? So it's just how dedicated you are to this. Don't know it just for the test, right? There's a reason why you chose science and pre-health. So I want you to like really feel the material, right? Get a tutor if you need and just reach out and make sure you expand your study groups. So we'll go past there. All right. So, as student optometrists, right, studying to get into the field, there's some soft skills that are going to be really important, right? Punctuality. Are you on time for things? There's times where I've worked with doctors that were always late, and I'm the optician standing there, and then I'm apologizing. How is that patient going to feel sitting in your chair if you didn't respect their time? Right? So now you're trying to get through the exam and you're not getting anywhere through them. So a soft skill like that you want to practice while you're a student. Firm boundaries. As an optician, I see sometimes there's things that go on in the exam room where, okay, maybe we should be stricter on policies. Maybe that could have been avoided. Sometimes it's up to the doctor and saying, no, I'm not going to finalize your prescription because I haven't seen the contact lenses on your eyes, right? People are going to want to buy online. You need to be really firm with these boundaries. And I can say that from looking in and having to step in as the manager to kind of back you guys up. And I say you guys because hopefully everyone on here is going to be a doctor like Dr. Johnson. People skills, right? I've seen doctors. I mean, I remember getting LASIK and he just did not have bedside manners, right? So I'm like, am I talking to a robot right now? And it's just, yes, the care was great, but it's just like that feeling, like you want people to remember you as a doctor. So start working on that now.
I took
Tenacity.
my day, so I have Monday to this off. Yeah. And I told the rest of the day.
Idea. Do here. Thanks. Let me go back. All right. So tenacity, what are you going to do when you fail? If you fail, right? Having that backup plan, having that network of people, your village, Dr. Johnson mentioned, right? Family, friends. No, get back up on that bike. You got this, right? It's really important who you surround yourself with, and that lends to resilience, right? So, and if Dr. Johnson wants to lend to any soft skills that you really need.
Yeah, so I think my best advice is start studying from day one. Not when you know about the first exam, start studying on day one. Even if it's just, what you learned that day. Um, and so yeah, I don't know if I can't see the next slide
Oh,
here.
sorry. I'll
Oh
change
yeah.
it.
Thanks.
Yeah.
Okay, so you've developed all those skills that Tasha just talked about. You have, you're punctual, you're a people person, you know how to take care of people, right? Um, from, a general standpoint. Now you're in optometry school, right? And you started studying on day one, right? Best piece of advice that I got, and I want to pass that on to you guys. Um, Keeping very good notes is going to be really important. Um, any slide in optometry school is fair game, right? There's no red font. This is going to be on the exam, right? Um, and so, there'll probably be some professors, maybe one or two, that might have some red font for you guys. But for the most part, everything is fair game. Get to know your professors, like, do you guys have anything in common? Do they do research in an area that you want to do research in? Not only did I get my optometry degree, but I also got my master's degree in vision science from SUNY at the same time. There was a professor there that was doing research on digital eye strain, right? So, how our digital devices, screens, computers are affecting our everyday life, and they're causing neck pain and back pain and headaches and all of these different things. And so we did research on that, and that was really cool. And so I got to know him, and the other thing is get involved. Say yes, right, to different programs. Say yes to being a part of different committees, right? Like get involved. Not only is that going to set you up for success in terms of optometry school, but you're going to meet people, you're going to make friends, you're going to build study groups, right? Different ones. And then you're going to know the staff, the faculty, the professors, right? And that's going to set you up for things like scholarships that you didn't think that you could get, right? Because now you're in somebody's ear, like, oh, this person works really hard. This person, introduced ourselves. Now we're working together, so you're on their mind now. And, one of the things, different awards, leadership awards, right? Community service, community-based awards. There's diversity awards. I think, just like how that happens for you in undergraduate school and how, your school gives out all these awards to students who are doing, different things, not just, educational things, but clinical things and community-based, service. Optometry school does the same thing. So at the end of my career, mine was more surrounded around community-based service, diversity and equity and inclusion. And so that's where I got my award. So think about those things before you even go in. Where do you want to leave your mark, right? The other thing is, ask yourself, what is your favorite part of optometry? What is your favorite part of this field? Is it, I don't know, taking pictures of eyes? I don't know, or maybe it's, I really love kids in this field, or I really love contact lenses, specialty contact lenses, or, I'm really into the business aspect of things, because that's going to help you pick what you want to do after optometry school is over, whether that's a residency or that is, owning your own practice, going into a group practice. Like that's going to help you out a lot. I did not do a residency. Residency is optional for our optometry or doctor's optometry. But one of the reasons why I didn't go and do my residency is because I didn't know what I wanted to do it in. Did I want to do it in disease? Did I want to be with the kids? Did I want to do it in vision therapy? Did I want to do it in um, low vision? There's so many other things, and I had no idea. So I said, I'm going to wait. I'm going to get out there. I'm going to work. I landed in a great place where I get to do lots of things, and now I'm leaning towards kids. Wow, who would have thought? But, I love it. And we're talking about myopia and myopia control. And it's a really great thing. So, ask yourself, what's your favorite part of it?
I love that. And then even as a student, you want to think about the end result, right? Think about what is the acceptance rate into optometry school. I know I keep harping on the self-awareness, right? But not everyone gets in. And that's the first time. Because remember, sometimes it takes multiple times and gap years. So the acceptance rate to optometry school is 40%. This was like a quick, statistics like Googling, right? But the people that do get in, right, the students that do, the optometrists that complete the program are 95%. So once you're in, right, you're golden, but it's just like from that 40%, what are those students doing? Right. And that's where opticianry comes in. Some things that I promote on Touch the Visionary is you don't have to fall off the bandwagon. You can do other jobs, right? That's within the field until you get to where you need to be on different levels, whether that's developing your OATs. So you just want to think about that, and you can definitely use me as a resource. All right, so now you're the doctor. Thanks, Dr. Johnson, right, for going into what happens after and all the choices, right? I'm sure we could talk about that like forever. There's different options, right? So you can go private versus corporate, meaning people start their own companies. It could be whether it's doctor owned, optician owned, or those big corporations. Do you want to be the owner or do you want to be an associate OD? Do you want to help another doctor build her business and you can come and go? That provides you with a lot of flexibility, right? Maybe because you have a big family. Pediatric versus geriatric. Dr. Johnson talks about this, right? It takes some time to kind of feel what you want to go into. Full-time versus part-time. What do you want your days to look like? And then you really want to go down to the nitty-gritty of the schedule. How many patients do you want to see an hour? Is it next, or do you really want to go into their treatment, diseases? Do you want 15 minutes versus an hour? And I'm sure Dr. Johnson can run to like how she came up to her choices. Okay. Yeah, so if you wanted to share anything about the different optometrist careers, is there something that you never wanted to do at all that's just like, or something that you never knew about?
That's good. That's a good point. I think I never thought that I would be a patient, or not patient, a doctor that would see patients, there we go, every 15 minutes. But here I am. I have a schedule where I see patients every 15 minutes. And this is full eye exams, medical eye exams, not routine eye exams. So there's dilation included in almost all of these exams. And but I have help. I have lots of help. I have two technicians and a scribe. Okay, the scribe takes all of my notes for me. I yell out findings and facts and talk to the patient, and they write everything into their chart. And then I have technicians that will work up the patients, take all the necessary information, their visual acuity, their pressures. They will take the history, and all I have to do is read it and ask the patient about it. And I'm spending a good 10 minutes with the patient. It feels like a long time, but it's because I have a whole team where I can sit and talk to the patient about their eyes. And it's really, really cool. And I love the way that I do work now. And, I don't know, I think, yeah, I definitely would like to slow down a little bit, but right now I'm just taking it all in and learning from the ophthalmologist that I work with. So, let's see, are we on the same? Yeah, there we go. So, also wanted to talk about, I'm not sure, did you go into this already? I'm not sure, but I'll talk about it.
Yeah.
So also wanting to mention that is one way to practice, right? Every 15 minutes. In a medical setting where I work at a private practice, that is a part of a private equity group. A private equity group is really a big bank that created this group that has multiple different practices across like a tri-state area. So there's about 40 practices where they have both ODs and MDs at these practices that work together. And we're all a part of this group. And so that's one way to practice. Then you have the other way to practice, and that's more on the corporate side, right? You have lens crafters, Target Optical. You have National Vision, Walmart. My eye doctor, right, is a big one. And within these corporate options and these corporations, we have a really big responsibility to work with our opticians like Tasha, right? And we have a really good working relationship with them because they help us in terms of not only getting the patient into the right glasses and into the right contact lenses, but they are your advocate, right? They back up, like she was saying, what you're saying in the exam room. And they also have a knowledge, and she can speak to this, they have a knowledge of eyes and, how it fits, in terms of why something might not be working. Why is this patient not seeing well? It's not just the doctor that kind of gives these explanations to the patient. It's also the optician that talks to these patients. They're thinking about dry eye. They're thinking about, and if that's affecting their ability to see. They're thinking about, okay, let me look at this patient's chart to see if they have any retinal pathology that's inhibiting this patient from seeing their best. Like, oh, if they come in to see the optician, they're like, oh, they have double vision, the optician is also responsible to say, hey, actually, I saw on your chart that you're seeing an ophthalmologist for something, fairly serious, and that might be affecting your vision. Maybe hold off on getting glasses today, or maybe you need to recheck with the doctor. So they're really knowledgeable, and I think that one of the uh, one of the things, the way that me and Latasha got connected was via social media again, after school, undergraduate school. And, now we're creating a really nice relationship with each other, from the optician industry side and to the medical clinical side, and kind of meshing those things and talking to you guys today. And I'm really excited about, what we're getting into and sharing that with you guys. And I do want her to speak to kind of the industry aspect of things and how her role really ties into how she works with optometrists really well.
Yeah, and I love that segue into that because if you think about these big corporations, sometimes it can get into the bottom line. We need to make money really quickly. And as doctors, you need to delineate like, no, yes, I can see patients every 15, but I'm not going to see 33 patients, right? Actually, some doctors are comfortably seeing 33, so maybe I'll say 45, right? So you really have to work really strongly with your optician because most times they're going to be the manager, right? And they need to advocate for you and you need to advocate for the optician. These are things some students don't really think about. So when it's time to choose a job or a location, work environment is going to be really important. Does that office have a strong optician? Say you join a team, right? And the optician is new, you're new, everybody new, right? And then you come and deal with all these difficult things. It's just like, okay, who are the ophthalmologists in the area and what insurances do you take? And right. So when you're choosing different corporations, figure out who's seasoned, who can I lean on just until I get my feet wet with patients, right? Because your optician is going to be a really big asset. They're going to let you know, okay, this town has this demographic. You're going to see a lot of geriatric patients. Or you know what? We got a lot of 35-year-olds in tech. There's a lab across the street. Can we start selling more like digital lenses? Can you start explaining it to them in the room? So there's going to be this feedback that has to happen. As students, you need to be wary of that. And then, Dr. Johnson also mentioned the position of scribes, right? That's a way to get into the exam room without the pressure on the optometrist. So look into scribe positions in these big corporations, and that'll help you get your feet wet as well. Okay. So we have that. I don't want to sing too much. Um, Dr. Johnson mentioned the differences, right, between medical, OD, hospitalists. I never knew about optometrists can work directly in the hospital. Did you want to speak to any of these career choices?
I just think it's something to take note of, right? Like when you go to optometry school and when you leave optometry school, there's a host of other things that you can kind of tap into, whether that's speaking, right? Consulting, right? And you can be a lighting consultant. I remember my professor said that one day, and I'm like, a lighting consultant? But, these are actually real positions as an optometrist that light. You've studied it for 4 years. You've studied optics. You've studied, um, how, different lighting can affect someone's workplace, right? Now you can go into these corporations and these big businesses and say, hey, let me look and see like how productive or unproductive your workers or employees are being because the lighting is horrible, right? I just wanted to kind of list some things that you can think about. I'm in private equity and I'm in an MD/OD practice where I work really close with MDs. I do a lot of post-op care, post-op cataract surgery. And I see a lot of these patients on 1 day out of surgery, 1 week out of surgery, 1 month. And we take care of them, right? And it's one of the best things on the 1 day. They're like, oh my gosh, I can see I had a patient today. And she was like, they tell you that once you have cataract surgery, it's so amazing, but you don't know just how amazing it is until you actually have it done. And it was such a beautiful experience. I actually asked her to, because I'm a part of the social media team at my job, and I asked her to, do a testimonial. So like, say you're into social media, you love to do graphics, you can do that in your workplace, right? You can add that. So I know we're kind of running on time here because we're about to get to the hour mark. But if I could, kind of skip through a little bit
Mhm.
to this debt after education? Because people don't always talk about that. Do you mind skipping to that? Thank you. So, if you are considering State University of New York College of Optometry, it's going to be about $50K a year for that first year if you're an out-of-state student, which was, the case for me because I'm from New Jersey. But then you can, once you live in the state, you can get in-state tuition. But you have to consider not only are you paying for your education, but if you are moving to the state and you don't live with family, you're also paying for your rent, utilities. You got to pay for transportation to get to and from school on the subway, and your ebooks, right? And then you consider that, and so you can come out of school with a good amount of debt because you had to pay your rent, right? Because you're not going to work. You can do something part-time, but so right now, students are averaging monthly payments to pay back their debt of $800 to $1,000. Okay, that's a monthly payment for to pay back your student loans. Okay. What was that?
I was like, I've been trying to save up for a convertible. I was like, that's a convertible price.
Right, exactly. So I'm like, that's nothing to sneeze at.
Yeah.
But you'll be able to do it, I promise. You'll be able to do these payments, thank the Lord. And so the other thing is that some jobs like mine offer loan stipends. Okay, what is a loan stipend? In my contract, I have that my company will pay $500 a month towards my student loans every month. Woohoo! Yay! Cuts it down, right? So make sure you ask about those things because those things are available to you. Okay? Perfect. And then I'm just gonna skip to the next one here. Not choosing an office unless you wanted to speak to that, but I was gonna skip right to the backup plan.
Yeah, we talked.
Okay. All right, we talked about that. Great. So, backup plan. So, Tasha and I talked about this slide a little bit, and I want to preface with how bad do you want it? How bad do you want to become an optometrist or be in the eye care field, right? Because I say if you want it very badly, this is something that you're supposed to do, whether it's in your heart or you feel as though it is something that you are supposed to do, that you are called to do this, right? Then that means that you need to do it and you need to get it by any means necessary. Okay. And this is coming from a person who had that mentality for 12 plus years, of trying to get into optometry school and then going through optometry school and finally getting to this point. I had plenty of doubts of like, can I do this? Or should I be doing this? Or, is this my calling? Or, is this where I'm supposed to be? So many questions about that, but I knew this is where I was supposed to be, so I was going to do it. That's what led me to taking the OAT 3 times. That's what led me to my post-bac program. That's what led me to, getting into all the schools I applied to, right? So like all of those things, working really hard to get there. And I say, only change if you want to, right? If you're like, like Tasha did, you know what? I really don't want to go to optometry school. I want to be a business leader and I want to still help people with their vision, but I want to do it in a different way. That was her pivot and she changed and she's doing something amazing with her pivot, right? Because that's what she wanted to do. And, she is going to end up exactly where she's supposed to end up, right? And happier for it. So, and then, I also want to say the last thing, how many no's will you meet until you get to your yes? Right? I applied to optometry school a number of times. The first few times I did not get in. I had the director of one of the admissions committee call me personally. And the reason why she called me personally was because one of their alumni who contributes to the school often wrote my letter of recommendation. She wanted to give me, basically she gave me a personal no, right? Like, she wanted to give me a courtesy call, right? And say, I'm sorry, da, da. And I took that and I said, and that wasn't the only time, but I said, you know what? I said, I appreciate your call. How could I have made my application better? Um, and she respected that. And it wasn't a few years later until I got into optometry school. Like I said, I ended up getting into all the schools I applied to and got an interview at every school. But it was, I had to take those no's, right? And then I finally got my yes. So, I really want you guys to take that with you, that you will get your yes if you continue to hear no's. You don't know how many you're going to hear, but at the end of the day, if you work hard at it, you will get exactly what you want. And, only change if you want to, not because you feel that you have to. Okay? I think Tasha had something she wanted to add to that. Yeah.
Yeah, so thank you to the students who came out tonight. Thank you to anyone watching the recording of this. As an optician, I really love what I do. I get a chance to still help the vision community, right? Provide eye care for those around me. I get to provide jobs, right? I get to help students because I've sat in their seats. It's just, I was like, you know what? I don't think that I'm helping the maximum amount of people in the room, right? And I get to help the people that come out of the room. So thank you for Dr. Johnson, right? For just sharing your personal experiences. Is not always easy sharing your, like what didn't go right or sharing what it took to be resilient. That's the hard part, right? So thank you for being vulnerable and transparent because students need to hear it. Yeah. And, thank you for Hunter College for having us.
Yes, thank you so much.
Thank you guys for being here. We really loved like everything about this. It was so like organized, and I wanted to say like a huge thank you because like it's not enough, and especially like sharing those experiences and not giving up, like it really means a lot. And I also want to add another thank you for not giving up, and
Mhm.
and congratulations.
Thank you so much. That was very sweet of you. Are there any questions, are any pressing questions that, you or some of the others, you could put them in the chat if you don't want to unmute, that's okay. Or if you want to unmute, you can, but, are there any questions that you have? And I think looks like you have our, social medias, so you can always reach out, take note of that and reach out later. That's fine too.
Mhm. I should have put the emails. Yeah, I'm latasha.latson@gmail.com just in case, right? It's going to be in the recording. All right. So if that is it for today, thank you for having us.
Yes, thank you so much.
Yeah, if you want to do another segment about backup plans or how to
Yeah.
choose it, just let me know, right? And then we'll hook it up.
Thank you. That was perfect. I definitely think we should also like suggest this to the pre-health office. Like it would be amazing if you guys even are part of the seminars like series and stuff.
Mhm.
Since like it's very like detailed and it could help a lot of students.
I love that. So
Yeah.
yeah, we could share the presentation and Dr. Johnson will probably be open to it.
Yeah, I definitely would be open to it. I actually was gonna reach out, but if you guys have more connects, that'd be awesome. If we can, if Tasha and I can do this PowerPoint for the pre-health, I would love to do that. Yeah.
Mhm.
Yeah, we'll definitely discuss that and we'll get back to you on that. Yeah.
Okay, sounds good. All right.
Thank you so much.
All right. Thank you.
Thank you
Have
so
a good
much.
Mhm.
Bye-bye. Have a good night.
night.
You too.